Welcome to the second topic in Section 3 of Unit 1, Common Postural Deviations. In this tutorial, we're going to look at what are considered common postural deviations. Remember, every body that you treat will be slightly different, so they will never fit exactly into a dysfunction, deviation, or even normal. Deviations in posture are what we consider to be a change in the normal posture. Because of the way the body works, nothing should be looked at in isolation. Always look at a body holistically. There are hundreds of examples where an issue in one place is causing no problems there, but has a massive knock-on effect elsewhere, potentially causing pain, compensation, and adaptation issues. We're going to run through a few common postural deviations and what they might look like, starting with upper cross syndrome. This is a hyperkyphotic position of the spine with protracted shoulder blades and a forward poking chin, a common desk-based posture. This may also be part of a posture of someone that's suffering with stress or depression. So the client will be slumped with rounded shoulders and with what I describe as a gooseneck. The shortened and lengthened areas by this condition can be divided by a cross, hence the name. Try sitting like this for a while and see where the discomfort comes. Generally in the back of the neck, which can potentially lead to headaches. There may be some lower back pain and definitely pain between the scapulae. You may also feel discomfort or compression in your sides and across the mid-abdominal area at the bottom of your ribs as you fold forward. Not only are there a lot of areas of discomfort around the neck and shoulders, there are also implications for some of the internal organs, reducing space and in turn their function. So what are you likely to see with upper cross syndrome? Certain muscles will potentially become lengthened, inhibited or overactive, which means they are not doing their job properly or unable to, while others become shortened, dominant and overactive, meaning they take control and do too much work. These are all muscles associated with the neck, upper back and chest. There are a lot of muscles that can potentially be involved, which are all listed in your manual. You'll be able to clearly see that muscles work in pairs, opposites lengthening and shortening. Next up is lower cross syndrome. Again, sets of muscles are either shortened, dominant and overactive, or become lengthened, inhibited and underactive. This imbalance of muscles will create or enable hyperlordosis, so this is an excessive curve of the lumbar back. This will create or allow excessive anterior pelvic tilt, which can lead to lower back pain. Again, sit or stand like this for a while and see where you feel it. Common causes can be overtraining specific muscle groups or neglecting others. Poor posture is a very common cause. The muscles affected can be dissected by a cross, and the muscles found in the lower back and anterior upper leg pelvic region become shortened, while the muscles in the abdominal and posterior upper leg gluteal area become lengthened. Moving on through the postures, let's look at sway back. In this posture, it appears the body has slumped down and forward at the waist. What has happened is there is a flattening of the lumbar curve. The thoracic section is leaning posteriorly, creating a hyperkyphotic posture in the upper back. The lower back then posteriorly tilts to compensate as there is a shift in the centre of gravity. When you look at someone, they will look like they're leaning back from the hips. You may also find they have hyperextended knees to further help maintain their balance. You will see the head poke forward slightly and a flat lower back. You will find, as with all these postures, certain muscles are overworking and others not working as well. Again, these are listed in your manual. You can mimic this posture by hyperextending the knees and pushing the hips forward, then slightly slumping the thoracic section. What you may find you get is a kind of pinching feeling in the lower back, which after a while becomes painful, and standing becomes uncomfortable for any time. You may also feel quite unstable in this posture. The military posture is next, and is very much as it sounds. You will see hyperlordosis while the chest is lifted up and pushed forward, causing in some cases hyperkyphosis of the thoracic curve. Because this is a very rigid posture and people will hold themselves, there tend to be more short dominant muscles than lengthened. The posture takes quite a lot of effort to hold. Again, try it and see where you feel it. Now let's look at a slump posture. We are all very capable of this one when we sit down. Your back becomes a big C, which would be hyperkyphosis and hyperlordosis. This generally comes about from a poor sitting position and can eventually be transferred to standing, giving the impression of being slumped in the upper body when stood. This could potentially reduce lung function as you are folded forward on yourself. Your posterior chain muscles will become lengthened and the anterior chain shortened. Flat back is our next posture and is where there is a hyperlordosis of the lower back. You will find an obvious flattened lumbar curve and stiffness in the region. Often clients cannot tilt their pelvis back and forth and there is a loss of flexibility and mobility in the lumbar section. There will be a posterior pelvic tilt, lengthened hip flexors and shortened hamstrings and rectus abdominis. Dowager's hump is an excessively hyperkyphotic posture, which over time can become extremely bad and debilitating. Weak muscles, osteoporosis, spinal fractures and other degenerative conditions can be the cause for this. It can be very painful and uncomfortable and is generally more common in women. I have seen a few cases of this in my career, from the very minor to the severe. It may be wise to seek medical guidance with this. Talk to the client first, they may have already spoken with their GP and be very aware of the situation. The muscles in the surrounding area may very well be under a lot of strain and discomfort, so you might not be able to improve the hump, but may be able to give muscle relief, if only temporary. The last one we're going to talk about briefly is sport-specific postures. These are generally adaptations from a repetitive action or position from the sport. For example, gymnasts tend to come up on their toes a lot and create a lordotic lower back. Whereas hockey players tend to be bent forward, creating posterior pelvic tilt, and to counteract this, when standing, tend to develop a sway back. Sporting postures are only the postures we have already looked at, but you might find additional elements such as rotations from a one-sided sport. If you work within sport, you will see common traits coming through. Within a professional sporting environment, you will be part of a multidisciplinary team. The role of the team is not only to keep the athlete fit for the sport, but to counteract these specific sport deviations. A multidisciplinary team could include any of the following: a doctor, physiotherapist, strength and conditioning coach, sports massage therapist, psychologist, sports-specific coach, and a management team. After looking at the various postural deviations, you can see where issues might occur. So what are the possible effects of the altered postures? The obvious one is the overactive and underactive musculature, which is really the cause of most of the following mentioned problems, such as joints being placed under more stress, potentially increasing wear and tear on them and increasing the risk of injury and damage. Another obvious one is the risk of pain and discomfort, leading to increased use of painkillers and anti-inflammatories, which carry their own set of issues, as well as secondary compensatory movement patterns being adopted to try and avoid the pain. A general higher risk of injury and altered movement patterns. Effects on the other systems of the body, such as the respiratory system, shallower breathing, for example. You might find synergistic dominance arising, a common dysfunction, which again can lead to an increased risk of injury. You also need to consider the psychological effect. People in pain can become mentally low, angry or withdrawn, which may in turn increase some of these postures, such as upper cross syndrome. As you have probably gathered, this can become a never-ending cycle, with short muscles creating weak ones, which in turn create joint dysfunction, which in turn can lead to neurological issues, which may lead to injury, which in turn brings you back to shortened muscles. Issues can start anywhere in the cycle, and you need to consider all these elements when treating. Again, it comes back to thinking holistically. So that's common postural deviations. Remember, there will always be anomalies. So think about what you see and try to understand why they have this posture before you try to fix it. Our next tutorial looks at common injuries and dysfunctions, which you can move on to once you've completed the quiz.